Hi, I'm Dr. Nick Meyer with St. Croix Orthopedics. I'm one of the hand and upper extremity specialists within the group, and I'm here to talk to you about sports injuries. One of our goals at St. Croix Orthopedics is to keep our athletes and our patients healthy and active and in the game. With my subspecialty in upper extremity care and my background as a college athlete, as well as now being an aging athlete, I understand the importance of those healthy hands. Keeping those hands healthy involves a two-pronged approach in the form of prevention and treatment. Prevention of injuries to the hand and wrist is best accomplished by anticipating how you might be injured. For example, snowboarders, skaters, skateboarders are susceptible to falls on an outstretched hand and wrist, resulting in a broken wrist or sprain. Basketball, baseball, and volleyball players, on the other hand, are more prone to finger injuries as a ball is coming at them. For the skaters and boarders, the use of a protective wrist brace such as this can be helpful to prevent wrist injury. These are great, especially for children, to be applied to prevent injury. For the ball-playing athletes, a simple way to prevent injury is to buddy tape the fingers, whereby you tape the small finger, ring finger together, for example, to prevent injury to that small finger. More deliberate forms of prevention involve the use of a fist when breaking a fall. For example, when skiing, think of punching the snow rather than falling on an outstretched hand if you do happen to fall. Falling on an outstretched hand is often a cause of injury to the thumb or fingers for skiers. Similarly, if you're playing baseball or softball, hold on to your batting glove when running the bases. That way, if you reach for the base, you're less likely to injure a finger. If you are unfortunate enough to sustain an injury, we can often get you back into the game with the appropriate level of splinting or casting or taping as necessary, depending on the injury and activity involved. For example, a stable wrist fracture in a football player can often get a player back into the game within 1 to 2 weeks with the appropriate cast or splint. Similarly, if a fracture is more severe and requires surgical stabilization, we can fix that fracture surgically, and then within 2 or 3 weeks, once the incision is healed, we can get you back in with the appropriate cast or splint. Some examples of splints that we have is this one, which prevents injury to the thumb and wrist. This one is simply to prevent injury to the wrist, it's isolated on the wrist itself. Here's another one to prevent injury to the thumb. And finally, a low-profile splint to prevent injury to the hand. These are helpful to get players back when they need protection, but do not need a cast and still need the functionality of their hands. While an ounce of prevention is certainly worth a pound of cure, the doctors at St. Croix Orthopedics will get you back in the game as soon as possible. Better yet, if you can prevent those injuries in the first place, we may never have to cross paths again. So be active, stay active, and keep those hands and wrists healthy.